One of the biggest questions I get asked is about the healthcare system in our city. And for good reason. Relocating isn't just about the home. It's about your quality of life. And I'll be exposing the truth about the Nanaimo healthcare system here. So keep watching. Hi everyone, I'm Rita and welcome back to my channel. Today we're going to be talking about something really important if you're planning on moving to Vancouver Island, and that's the healthcare system in Nanaimo, BC. Whether you're moving from another province or from out of country, the healthcare system works a little bit differently here, and it's good to know what to expect. From walk-in clinics to finding a family doctor to urgent care centers and phone appointments, here's how the locals navigate the healthcare system here, and I promise you I won't sugarcoat anything. But before we begin, please do me a giant favor and like this video and subscribe to my channel. This way you'll be kept up to date with all things Nanaimo, BC. And if you'd like to get in touch with me directly, there is a link to my calendar to book a time that works for you to chat with me directly. So first off, yes, BC does have a publicly funded healthcare plan, meaning essential medical services are covered under the Medical Services Plan or MSP. So medically necessary services include things like doctor's visits, hospital visits, and some diagnostic tests, but do not cover things like most dental care, vision care, and ambulance services, for example. You can have these services covered through extended benefits packages through your employer or privately. And if you're new to the province, having private health insurance is strongly recommended, as you'll have about a 3-month wait time for MSP to kick in. So if you're new, save yourself the frustration of waiting and sign up right away. I will link to where to do this in the video description. So now here is the elephant in the room, getting a family doctor. This is still a huge frustration for people living on Vancouver Island, especially for those underserviced communities. There just aren't enough family doctors, and with our population growth paired with a lot of doctors retiring their practices, a lot of locals are left wondering what to do. In my personal experience, once my family doctor found out I was moving from North Vancouver to Vancouver Island, he strongly recommended that I stay on as his patient. Now, this isn't always possible. Some doctors can't accommodate out-of-city patients or simply won't, but it is a discussion, in my opinion, that is definitely worth having. One way of finding a family doctor in British Columbia is by joining the Health Connect registry, which is an official waitlist, and once a doctor or a nurse practitioner has space, they will contact you. But the hard reality is that most people on these waitlists on Vancouver Island and Nanaimo are waiting months, sometimes even years, to get a family doctor. That's why virtual care, HealthLink BC, walk-in clinics, urgent primary care centers become your go-to tools while you are waiting. So if you don't have a family doctor, my recommendation would be to book a virtual care appointment through HealthLink BC. You can call 811 to speak with a pharmacist, a nurse, a doctor, anytime, day or night, and they can help answer any questions you may have in regards to your health, where to go for care, and even troubleshoot certain options for you. So HealthLink BC is definitely one of the easiest and quickest ways to get health advice if you're new and you're not really sure where to go. Other apps like My TELUS Health or Rocket Doctor are ways that you can book appointments with health practitioners, but the problem here is there isn't a continuation of care, as you're unlikely to see the same doctor twice. It is, however, in my experience, the easiest way to get something simple like a prescription if you don't have a lot of time to waste. Now, Nanaimo does have walk-in clinics, and these are to treat non-urgent medical issues like your common cold or to get prescriptions. And while it's possible to get a same-day appointment, availability does vary, as it is a first-come, first-served system. I would say if you are planning to go to a walk-in clinic, give yourself lots of time, as most wait times will be a minimum of 90 minutes. And in Nanaimo specifically, many of these walk-in clinics are now requiring you to call ahead of time. So it's important to get on the phone first thing in the morning, and I will link to a Medimap in the video description so you know exactly where to go. Another option if you're living in Nanaimo is our urgent and primary care centers. These operate much like a walk-in clinic for non-emergency medical issues, but operate on a more team-based care setting. Nanaimo has the Medical Arts UPCC downtown and more recently opened a second urgent primary care center at 3260 Norwell Drive. This new clinic operates 7 days a week from 8 a.m. to 8 p.m. and offers same-day care within 12 to 24 hours without having to go to an emergency room. And finally, like most cities, we do have a hospital with an emergency room. So if you are in a more critical condition, you can head to the Nanaimo Regional General Hospital or NRGH. But like most emergency rooms, you will be triaged, so you'll be assessed on the severity of why you're coming in. So if you're there for a minor scrape or a cold or a cough, you may be waiting several hours. So what's interesting is when I sat down to think about how to tell you all about the Nanaimo healthcare system, that day I got a text from my partner saying that he was injured in his hockey game. Now I received this text at around 8:30 or 8:45 at night, and what happened was he got a puck to the face, his lip split wide open, and after seeing it on video, I realized very quickly that it would require stitches. And so we were faced with this real kind of medical situation. After kind of brainstorming what our healthcare system was like, it was time to put it to the test. So something to keep in mind is Corey does have a family doctor, but this was late at night. And we do have urgent care centers in Ladysmith and in Parksville as well, but those are closed at 9 p.m. So off to the emergency room he went, to the NRGH, and there he was triaged and told to wait. And in his experience, he sat and he waited for quite some time. So while he was there, he did see a few people that seemed like they were in distress. Those people were seen sooner, obviously. And by the time he was seen by a doctor and stitched up, it was around midnight or just after midnight. And I think this is quite a common story, unfortunately, for people living in Nanaimo. Now, a follow-up to that, he did get stitches, as I mentioned, and he was told to follow up with his family doctor to get them removed in about 4 to 6 days. His family doctor wasn't available on the day that he was meant to have his stitches removed. So we did what we should, and we called the walk-in clinic to be put in a queue for him to be seen. So we were on the phone, we were on hold, and we heard, "You are 15th in line," and in starts the hold music. And this went on for quite some time. Had it on speakerphone. I think we got down to 13th in the queue, and then the line disconnected. So after that frustrating experience, we waited one more day and contacted the primary care center on Norwell Drive, the one I just previously mentioned. The wait time wasn't quite as long. We called at 8 a.m. when they opened. So a nurse answered the phone, and he was triaged over the phone. And he was basically told that he would be seen in the order of the severity of the day, which could be anywhere between 12 and 24 hours. And if we didn't hear from them, we would have to call back the next day. Luckily for him, he did get a call within about 3 hours. He went in, got his stitches removed, and it was pretty quick. So in the end, it did work out. He did get seen. He did get the medical treatment that he needed. There was a little bit of apprehension, like, oh my gosh, what's going to happen? You know, you get injured late at night and you don't know where to go. Obviously, it was a little bit of a wait time and a little bit of, oh my gosh, what's going to happen? But I think this is a common experience nationwide, not just in Nanaimo, BC. And the important thing is that he was treated. So I didn't want to leave you all with all doom and gloom. Yes, the healthcare system here is flawed. Some exciting things to come are a brand new hospital near Lake Cowichan, which will be just about 40 minutes from Nanaimo, and that is the Kawutsun General Hospital opening in 2027, as well as a brand new cancer care center opening right here in Nanaimo in 2028. Construction has already begun, and I thought this would be a great opportunity to go to the building site with my good friend William Litchfield, who is the head of the Cancer Foundation on Vancouver Island. Enjoy this sneak peek. All right, we're here in the hospital district of Nanaimo, and I have my good friend William Litchfield, who is the head of BC Cancer on Vancouver Island. And he's going to talk to us a little bit about something very exciting for our city, and that is a new cancer center. So where are we today, Will?
We're standing in front of the new BC Cancer Nanaimo building. So this is right at Dufferin and Boundary, where we're going to be building a brand new cancer center to support all of the Mid and North Island.
Amazing. And what does this mean for the people of Nanaimo?
So every year there's about 6,000 people diagnosed with cancer on Vancouver Island, and about half of them live on this side of Malahat. And so for them to access care, they're going to have to travel down to Victoria. Means when this building's open in 2028, that families are going to be able to get their care close to home. They're going to be in their own bed with their community, with their support, being able to walk their own dog, be in their own bed each night while getting the care they need.
That's amazing. So when is this all going to come to fruition?
So we've already broken ground. Construction's about a 3-year process, so we'll be open in 2028.
All right, super soon. That's amazing news. And so what is your biggest hope for the people of Nanaimo and this center being built?
I think the biggest thing is it brings the opportunity for people to get treatment that they need close to home. So we're bringing in a PET CT scan, which is our #1 diagnostic imaging tool. There's only 4 in all of BC Cancer, and the 5th one will be here. So Vancouver Island will have the same capacity as the entire lower mainland when this one comes on board. There'll be 4 radiation bunkers. We'll be doing 20,000 treatments a year, which means people can get the care they need close to home. And so it keeps families together, it keeps communities together, and it means people get world-class treatment at home.
That is incredible. Well, thank you so much for taking the time to speak with me today, and we'll be watching this very closely. So that is what I have for you today. I hope you enjoyed this video on a topic that I think has been on everyone's mind, especially if you are planning a move to Vancouver Island. And if you do have certain experiences that you'd like to share, please drop them in the comments and feel free to get in touch with me directly by following my links in my video description. Again, I'm Rita Fraser. Thanks so much for coming to my channel, and I'll see you next time.